Great breakthroughs in medicine rarely appear out of nowhere and often are as the result of an intense race between famous surgeons. In 2005, we saw such a race between Dr. Maria Seimionow of the Cleveland Clinic, who had been preparing for 20 years to do a face transplant. Careful, methodical, she wanted to be sure that she had the right recipient and that the recipient would do well. In France, in Lyon, Dr. Jean-Michel Dubernard knew that Dr. Seimionow was about to do a face transplant, and he yearned for a huge success. He had already done a double hand and forearm transplant. He was facing retirement, mandatory, and he, instead of running methodically, he sprinted to the first. He achieved the first face transplant with Isabelle Denoir, and now we know his name. He was the hero that we know. That's the way the story is often told of who gets a first in medicine. Why do we tell stories this way? Isn't it more important to know who did the first operation ethically that really helped the recipient, rather than just who did it first? I'm Gregory Pence. This is Great Stories in Bioethics, my personal YouTube channel. And today, our episode is not only about face transplants, but it's a kind of a story within a story about why we recognize people who achieve a first in medicine, even though there may be some dark corners about how they did that, and sometimes the people get hurt along the way. So you may remember that in the very first episode, I talked about Christiaan Barnard and his first heart transplant and his great desire for fame. And the name we really should remember is Dr. Norman Shumway, who was, like Dr. Maria Seimienow, carefully preparing to do the first heart transplant, wanted to make sure that people benefited from a heart transplant, weren't just used as a guinea pig for his own vanity. And his IRB was holding him back a little, and Barnard jumped the gun. I didn't tell you in that episode that the first recipient was not a great choice, Louis Roszkowski, and Barnard didn't really know how to control rejection. But the most pivotal moment occurred when Washi was dying, and he didn't want to go back on a breathing machine through a tracheotomy hole, and he wanted to be able to talk to people at the end of his life. And Barnard forced him to go on a tracheotomy against his will. And of course then, after Washi died and Barnard became famous, he abandoned his patients. We also know that with the first artificial heart, William DeVries in Utah chose the wrong person. Barney Clark, a chain smoker, he was absolutely miserable and died in a really miserable way. In 1998, he achieved the first double-arm transplant with an ex-convict named Clint Hallman. And you would have thought that this would be enough, but it was a failure. Dubernard had chosen the wrong person. One of the keys to any transplant like this is success is taking immunosuppressive drugs regularly. Hallman wouldn't do it and also wouldn't do the physical therapy. After a while, his arms turned gangrene and he requested that they be taken off, which were done. So it really wasn't much of a famous thing to do. Dubernard was facing a mandatory retirement age at 65. He was an interesting guy. He was deputy mayor of Lyon for a while, his city. He was a member of the French National Assembly, where he went 2 days a week. And the other 5 days he was back home in Lyon doctoring. But he was a very driven man, a chain smoker, someone who desired for, quote, a huge success before he retired. Meanwhile, back in America, Maria Seimionow had been very carefully laying the groundwork for not only her face transplant, but for people who followed, just like Shumway in Stanford, who trained many heart surgeons after his first heart transplant, which he was, of course, the first to do in America. Knowing that she was about to do a face transplant, Dubernard chanced upon a woman named Isabelle Denoir. This is 7 years after he did his hand and arm transplant of Ken Holman in 2005. Isabelle Denoir was not a great candidate for the first face transplant. She had tried to commit suicide by hanging herself and taking an overdose of pills. Her newly acquired Newfoundland retriever tried to wake her up and bit off part of her face. She was in the hospital for months with facial reconstruction, but it wasn't successful. When she talked, there was still an open area and you could see her jaw bone move. After a couple months, there was another woman named Saint Aubert who also hanged herself in France. This was not great because in hanging herself, she had cut off a nerve and some arteries in her neck, which damaged her face. But Dubernard talked a surgeon named Bernard Duvachel into taking a triangular flap from Aubert's face and putting it into the face of Denoir. It's unclear exactly how carefully Denoir was consented. Apparently she must have had some kind of consent. Did she really understand what was ahead of her? She was a chain smoker. She was not willing to give up smoking. She immediately started smoking again after the partial face transplant. After Duvachel did the surgery, Dubernard took over managing her. And this is going to be a big deal medically because she has to take immunosuppressive drugs for life. She's going to get infections with an open wound. The smoking didn't help. So there's a personal aspect of this story. Dubernard had been a surgical resident, with a UAB surgeon named Gil Diethelm, one of our liver transplant surgeons. And right after the operation, when Dubernard became very famous, like Barnard, Dubernard made one of his only visits to America, gave grand rounds at UAB. And before that, I got to meet him privately, and he had recently given up chain smoking, and he was still in the throes of nicotine addiction. And at one point in our conversation, his cell phone rang, and he sort of had great anxiety answering it. It was nothing, but afterwards I asked him what was the matter, and he said, well, every time his cell phone rang, he feared that Isabelle Denoir's whole face had sloughed off. He was unsure that it was going to stick, and he was feeling guilty being so far away from her. It worked out okay. Isabelle Denoir had this flap, triangular flap, worked fairly well. She lived for basically until 2016, so she lived 11 years more. Dubernard has since died. I guess he got his fame. Meanwhile, back in America, it wasn't until 2008 that Maria Seimionow found the right person. Her name was Connie Culp, and her husband, a very abusive man, had shot her in the face. Culp had endured 23 surgeries trying to get her face somewhat normal. And of course, the key thing here is constructing an airway that a person can breathe normally, and also a way for her to eat normally. Culp had endured all these surgeries, but still things weren't working out. And then a nurse named Anna Casper became brain dead, and her family agreed to donate part of her face to Connie cult. And so in 2008, Maria Seimienow with her team, in fact, did have the first American face transplant, and Connie Culp lived many more years afterwards, somewhat normal. The key thing here is, number one, selecting the right recipient who will take all the immunosuppressive drugs. You also need the right fit for the face. Later, at the same Cleveland clinic where Maria Seimionow had laid the foundation for face transplants, a young woman named Katie Stubblefield was a famous case. Katie was from Oxford, Mississippi, and in a fit of depression over a boyfriend cheating on her, had taken a rifle into the bathroom and blown off the front of her face, trying to commit suicide. Katie and her family endured years of surgery at the Cleveland Clinic, trying to reconstruct the face. Finally, a donor who had died of a drug overdose appeared, and the team at Cleveland Clinic struggled with Katie's face transplant, partly because the donor's face was bigger than Katie's head. And they made the decision to go ahead, even though there was some awkward aspects of this. There's a great video by National Geographic about this whole case. Face transplants are never going to be the way they are in the movies, where there's this movie with John Travolta called Face Off. The results are a blend of two different faces, and they're often not aesthetically very pleasing. The reality is nothing like what's in the movies. In 2015, they were costing $300,000. It's probably more like $1 million, really. So it's never going to be a common thing. But also, back to the story within the story, we need to always think about not only who was first in medicine, who was first to do the surgery, but who did it ethically. There will be people who transplant an animal heart or a pig kidney into a human. Is it the right person to get the drug? Are there viruses that piggyback in that hurt the whole human race? We need to know about the ethics of surgeries, not just who got to be first. Otherwise, we'll have many more Christiaan Barnards and William DeVries hurting people with their own ego. So today was a little bit different. It's more about the dark side of medicine and surgery. I hope you learned from this. I hope you enjoyed it. That's all for today. If you like it, give me a thumbs up, subscribe. I'll see you again next Tuesday at 4 p.m.